Hi, this is Walt Fritz from Foundations and Manual Therapy Seminars. I've been at this business for a lot of decades now, and I learned a lot of really good manual therapy, therapeutic skills, therapeutic exercise along the way. What makes my approach unique? Well, it's not necessarily the hands-on work that we do, because it's sort of a collection of a lot of different modalities and educators that I've worked with over the many years: myofascial release, craniosacral therapy, general manual therapy, general exercise-based therapy. But the one thing that I saw, I guess lacking is the wrong word because it's very judgmental, but that might be a limitation with some of those models, is they're based nearly entirely off the expertise of the clinician. And that's kind of our role over history, is education, further training, continuing education, mentoring, all those things, so we can become an expert at what we do. Pretty much the nature of the medical model and the healthcare model. But I see one thing missing from that, and that's two-way communication. Shared decision making is at the core of my approach, and it's a model that's really uncomfortable for a lot of clinicians, because it's about sharing power. It's about sharing decision making. It's about, in a way, it's about admission that my knowledge, my expertise, my experience only goes so far. There's a boundary to that, and that boundary is where that individual patient's expertise, lived experiences comes in, their opinions, their values, their expectation, which is truly 1/3 of the evidence-based model, right? Patient values and expectations. And if we can figure out ways to leverage patient preferences and values, I think the literature supports it, as well as I believe it, that it improves our outcomes. A lot of times manual therapy, massage, myofascial release is done in a very quiet atmosphere, or with minimal conversation, with beliefs that we need to let our patient go deep and experience deeply and come up with their own meaning for some of the feelings they're having. And yeah, it's certainly how I learned this work. And it has value. A lot of patients really respect that and look forward to that, expect that almost. And when they come in to see me, it's like I'm allowing that, but I'm also asking for their opinion. And occasionally a patient will respond that, why are you asking me so many questions? Shouldn't you know these things? Or, I feel like I want to go deep and experience that. Yeah, I certainly respect that. But I let them know that, yeah, I am an experienced therapist, but my experience says that I need to bring in your experience. That communication, I think, is key. When people come and take my classes or do it online, it's a very different experience, because, yep, the hands-on skills are important, but so is the communication. And my seminars are almost about teaching one way to communicate, as much as it is about the manual therapy that we're doing, and using that communication. New learners, people who've never used touch-based therapies as a model of intervention, might actually find that the work is easier to learn when you allow the patient to help you help them, versus you being tasked with being the expert in terms of palpation, et cetera, et cetera. We're allowing the patient to guide our interventions. And, it's a tough road for some people, but I think it's a worthwhile road. So, if you want to learn more, send me a message or check out the website, waltfritz.com.